Okay, we've all seen a black eye, right? Someone takes a hit and you get that classic purple bruise. But what if I told you there's a type of bruising that looks kind of similar but has nothing to do with a punch? Instead, it's a critical warning signal sent from deep inside your skull. Let's break down what this mysterious sign is really trying to tell us.
So, at first glance, you might think these are the same thing, but they are worlds apart. On the one hand, you have your regular black eye. It's simple, direct impact, shows up pretty fast, and it's usually just on one side. But raccoon eyes, that's a totally different story. The cause isn't a punch to the face, it's internal bleeding from the base of your skull. It can take up to 3 days to even show up, and it's often on both sides. One is a surface wound, the other is a message from a much, much deeper problem.
So this is the big question, right? It's not just a bruise. It's a message, written in blood, that had to travel from a hidden spot just to become visible. What on earth is the body trying to signal when this appears? To solve this mystery, we have to start with a little anatomy. See, the reason this sign is so specific, so unique, is all because of how our faces are built. The clues are literally written into our bone structure. Okay, meet the star of our anatomical story, the orbital septum. The easiest way to think of it is like a thin, tough barrier inside your eyelid. Its whole job is to keep the important stuff deep in your eye socket, separate from the skin on the surface. And this little membrane, it is absolutely crucial for understanding what's going on. And here's the dead giveaway, the single most important clue. With real raccoon eyes, the bruise has this sharp, clean edge. It doesn't actually go into the eyelid itself. Why? Because that orbital septum we just talked about acts like a dam. Blood coming from a deep skull fracture pools behind it, but it can't cross that barrier. A direct hit, on the other hand, breaks blood vessels in the eyelid, so the whole thing gets bruised. That sharp cutoff is proof positive the blood is coming from somewhere else entirely. This also explains why it takes so darn long to show up. This isn't like an instant Polaroid of an injury. It's more like a photo developing slowly in a dark room. First, the fracture happens deep at the base of the skull. Then, for the next 2 or 3 days, that blood has to slowly seep along the floor of the cranium, finding little pathways until it finally collects in the soft tissue around the eyes where we can see it. That delay is another huge piece of the puzzle.
All right, so we know the blood is coming from deep inside and taking its sweet time to get there. This leads us straight to the #1 culprit, especially after an accident, a basilar skull fracture. We're talking about a break in the very bones that form the foundation of your cranium. This is a serious, high-impact injury. And just look at this number. When a patient shows up with bruising around both eyes after a major trauma, there is an 85% chance they have a basilar skull fracture. Let me tell you, in the world of medicine, a clinical sign with a predictive value that high is a massive red flag. It tells doctors exactly what to look for right away. Now, raccoon eyes rarely show up alone. They're part of a whole team of clues, a constellation really. Doctors will immediately look for Battle's sign, which is bruising that appears behind the ear. They'll check for blood behind the eardrum, and they'll look for any leakage of cerebrospinal fluid. That's the clear liquid that protects your brain, from the nose. If you put a drop of it on gauze, the clear fluid separates from the blood in a ring, creating what's called a halo sign. Each clue helps build a clearer picture of the damage. Now, a fracture this bad doesn't just let things out, it can also let things in. And one of the most dangerous complications is something called pneumocephalus. It's exactly what it sounds like. Pneumo for air, cephalus for head. It means there's air inside the skull, where it absolutely should not be. A fracture can tear the protective lining of the brain, creating a direct open door from your sinuses right into your head. So you're probably wondering, how on earth does air get into a sealed system like the skull? Well, there are 2 pretty wild and terrifying ways this can happen. The first is a ball valve effect. You sneeze or cough, forcing air in through the fracture, but then a flap of tissue closes behind it, trapping the air. The second is even crazier, the inverted soda bottle effect. As that cerebrospinal fluid leaks out, it creates a vacuum that literally sucks air in to fill the space. And if enough air gets trapped, the pressure can build and build, literally squeezing the brain. It's a condition called tension pneumocephalus, and it is a neurosurgical emergency. On a CT scan, as this quote explains, the trapped air can actually push the 2 halves of the frontal lobe apart, creating a shape that looks just like Mount Fuji. It's an unforgettable image for a truly life-threatening situation.
So, up to this point, it's all been about major trauma, car accidents, bad falls. We've built a really strong case. But this is where our medical mystery takes a huge pivot. What happens when there was no injury? What if a child just develops these bruises, or an adult wakes up with them one morning?
This is the question that changes everything. When you take trauma out of the equation, raccoon eyes stop pointing to an external injury and start pointing toward a serious internal disease. The sign is the same, but the cause couldn't be more different.
In children, the most alarming non-traumatic cause is a cancer called neuroblastoma. It's the most common solid tumor in kids outside of the brain itself. It grows from the very early nerve cells of our fight-or-flight system and can spread very aggressively.
So, how does this cancer cause raccoon eyes? Well, when neuroblastoma spreads or metastasizes, one of its favorite places to go is the bones around the eyes. The tumor tissue actually invades the area and physically blocks the tiny blood vessels, causing them to leak. In this awful case, the raccoon eyes are a direct sign that the cancer has spread, and tragically, it's associated with a much poorer prognosis. Now, in adults, the non-injury story is different, but it's still incredibly serious. Spontaneous raccoon eyes can be a telltale sign of a rare disease called AL amyloidosis. With this condition, abnormal proteins deposit themselves in the walls of blood vessels, making them unbelievably fragile. We're talking so fragile that a simple cough, a sneeze, or even a minor bump can cause them to rupture and bleed, especially in the delicate skin around the eyes.
So, we have this one sign that could mean anything from a catastrophic skull fracture to metastatic cancer to a rare systemic disease. How in the world do doctors figure out which one it is? This brings us to the final piece, solving the mystery and understanding why it matters so much.
While the approach is very systematic, it always starts with a full physical exam, where they're hunting for that whole constellation of clues we talked about earlier. Step 2 is almost always a CT scan. That's the gold standard for spotting a fracture, or blood, or that scary intracranial air. Then, if there's no evidence of trauma, they move on to more specialized tests, like a tissue biopsy to check for amyloidosis, or specific lab tests for neuroblastoma. And that brings us to the most important point of all, the one thing you should absolutely take away from this. Raccoon eyes are never, ever just a bruise. They are a profound signal that something has gone very wrong. Either the body's ultimate fortress, the skull, has been broken, or a serious disease is attacking the body from the inside out. It's a sign that demands to be taken seriously.
It's pretty amazing when you think about it. A simple-looking pattern of bruising can tell this incredible story of anatomy, physics, and disease. It really makes you wonder, what other silent signals are our bodies sending us all the time, just waiting for us to learn their language?